afternoon, everybody. My name is Zahra Rothenberg. I am licensed by the state of California, and I'm certified by multiple different health insurance company. So today we're going to go over Medicare basics. The topics we are going to cover is what are your choices when it comes to Medicare. Then we talk about what's original Medicare and what is Medicare eligibility. Then we go over different parts of Medicare, Part A, B, C. We briefly talk about Medigap. Then we go over prescription drug and different stages of drugs and different tiers of drugs. And then at the end, briefly, we talk about extra help with prescription drug. As Marcy mentioned throughout the presentation, if you have any question, please enter it into the chat, and I will stop a few times and we make sure we answer all your questions. Now, if your questions are really specific to you, I'm going to ask you to wait until the end and then ask me the questions so that I can go through the presentation smoothly. And if you're, you feel more comfortable, feel free to call me later tomorrow and ask your question directly. Okay, so we move on. Okay, Medicare consists of two parts, Part A and Part B. When you turn 65, if you have worked for 10 years or 40 quarters, and if you have paid your Social Security and Medicare taxes, you are entitled to Part A and you are eligible for Part B. Part A covers inpatient hospital. That means you have to get admitted to the hospital. Part A does not have a premium and it covers 100%. However, it has a large deductible. Part B covers outpatient hospital. It covers your doctor visit. It covers any sort of lab or test or anything you have. Part B does have a premium and it only covers 80%. And it has a small deductible. Now, the amounts of the deductible and the premiums, I'm going to go over it when I cover the future slides. So when you apply for your Medicare, you get your Medicare card, which is this red, white, and blue card. On the card, you'll see your name, you'll see your Medicare number, and then you'll see an effective date for your Part A and an effective date for your Part B. If you apply for both parts at the same time, obviously you would have the same effective date for both parts. If you apply for each one at a separate time, then obviously you would have a different date. For example, when you turn 65, you may choose, if you're still working and your employer gives you creditable insurance, you may choose not to apply for Part B. You apply for Part A because you don't have to pay for it anyway. And then you wait until you retire, and then you're going to apply for your Part B. In that case, then the effective date for your Part A and Part B would be two different dates. Okay, so now Medicare Part A and B combined, they are referred to as original Medicare. Now, original Medicare, as you can see, does not cover everything because A has a large deductible and B only covers 80%. And combined, they don't cover prescription drug. So most everybody, once they apply and they get their Medicare card, they go into private market and they apply for private insurance to complement what Medicare does not pay and get a full coverage. When it comes to going to private market, you basically have two options. Now, each option has its own advantages and disadvantages. So it's really up to you to see which one better fits your needs. Option one is after you get your Medicare A and B, you go to private market and you get a Medicare Medigap, which is also known as Medicare supplement. So the Medigap basically fills in the gap that Part A and B does not cover. So it pays for the deductible for Part A and pays the 20% for Part B. And so the advantage of this Medigap is it is flexible. That means if you have this plan, you can go to any doctors, any hospital, anywhere in the whole United States, as long as they accept Medicare. So let me repeat this, as long as they accept Medicare. So you cannot assume everybody accepts Medicare. So if you go to a new doctor, new city, first thing you ask is, do you accept Medicare before you go and see them? So this is a good flexibility because it really opens a lot of range of possibilities for you. But the disadvantage is the premium for this plan goes up by your age. So that means not only it gets adjusted occasionally because of cost of living, every year on the month of your birthday, your premium goes up. The other disadvantage is that the Medigap does not include prescription drug. So if you choose to go with option one and get Medigap, you have to go and apply for a standalone prescription drug, which has a separate premium. So if you go with option one, you would carry 3 cards with you at all times, which would be your Medicare card for the Part A and for 80% of your medical. You would carry your Medigap card for the 20%, and you carry your prescription drug card. So all 3 together is a complete package that would cover you. The other option is option 2. Option 2, some years ago, Medicare realized that they're spending a lot of time and a lot of money doing the administrative work and processing the claims. So they made contract with private insurance company, and they pay private insurance company for every individual who is part of Medicare. They pay a certain amount of money to the insurance company so that the insurance company would handle all your Medicare needs. Now, you don't lose the benefit that you had under A and B. All those benefits are embedded in your option 2, which is also known as Part C or Advantage Plan. Some refer it to you as Advantage Plan, some refer to it as Part C. So when you get Part C, everything is bundled into one plan. And as a result, you only carry 1 card with you at all times, because this really shows that you have Medicare A and B. The disadvantage of this plan is whether it's an HMO or whether it's a PPO, you belong to a network. If it's an HMO, you would need a referral from your primary care to go to see a specialist, and you cannot go outside of your network. If it is PPO, you do not need referral, and you can go outside of your network. However, you may end up paying a little bit more. So the advantage of this Part C plan is the premium does not go up by age. So regardless of your age, you pay the same premium for the same plan. The other advantage is this Part C plan, the Advantage plan, it also gives you prescription drug. So you don't have to go and pay a separate premium to get the prescription drug. And in addition to prescription drug, some plans offer you more benefits, such as they may give you gym membership, or they give you an allowance for over-the-counter drugs, or they may give you a certain number of transportation from your house to visit your doctors or your pharmacy. So these are the extra benefit that you get with the Advantage plan for the same premium that you pay. So at this point, when I talk to my clients, they all ask me, well, Zahra, which one do you think is better? And my answer always is, well, it depends. It depends on your specific needs. It depends on basically your budget. So for example, if you happen to have all your doctors and specialists and hospitals at the same medical center, and the medical center is covered by the Advantage plan, you may choose an Advantage plan. Why pay extra money to go to a supplement when you can continue going to your doctors and hospitals? But if your doctors are scattered all over and you have attachment to them, you don't want to change them, you want to continue going to see them, then maybe a supplement plan would be a better plan for you, because it gives you the flexibility to keep all your doctors. So at this point, I think, Marcy, we're going to stop and see if I covered a lot. Let's see if anybody has any questions.
So far, we don't have any questions in
Perfect.
the chat.
Okay. So then we move on. Now I'm going to go over the text and I'm going to give you some numbers. The numbers in this presentation, they're all for 2021. Medicare site have not updated their site for 2022 numbers. So again, when you turn 65 years old, you are entitled to your Part A and you're eligible for Part B. And some people, if they are younger than 65 on the basis of disability, they qualify for Medicare. But you have to be disabled for at least 24 months before you qualify for Medicare. Some people who have end-stage renal disease, that is, if somebody is on kidney dialysis, or if they have ALS, they qualify for Medicare. You have to be a U.S. citizen, and you can be a U.S. permanent resident, but you have to be at least a permanent resident and have lived in U.S. for 5 consecutive years. Now, Medicare Part A is inpatient hospitals. It has 0 premium, but it has a large deductible. In 2021, your deductible for the first 60 days that you stay at the hospital is $1,484. After the 60 days, on day 61 through 90, then you would pay $371 per day. And after 90 days, Medicare gives you a 60-day extra for lifetime. So in other words, if 1 year you stay in the hospital for 92 days, you dip into your reserve of 60 lifetime days for 2 days and keep the rest for future years. Medicare Part A, it covers your skilled nursing for 20 days, day 1 through 20. And then beyond 20 days up to 100 days, you pay $185.50 per day. It covers home health care. You don't pay for that. And it covers hospice. Now, these are the amounts that Medicare Part A does not cover. But remember, if you get additional private insurance company, those insurance company covers this cost. Okay, next page. Now we're going to go to Part B. Part B covers your services for your doctors or healthcare providers. It covers outpatient care. It covers home health care. It covers some of the durable medical equipment, like a special bed or wheelchair. And it covers some of the preventative services. Now, the plan may cover a lot more preventative services, but the Medicare only covers certain preventative services. So, Part B, remember I said it only covers 80%. Part B has a premium, base premium in 2021 of $148.50. Now, your premium is based on your annual adjusted gross income. When you file your taxes, Medicare has access to your taxes and they can see what is your medical, what is your annual adjusted gross income. If your adjusted gross income, if you're filing as a single and your adjusted gross income is below $85,000 a year, or if you're filing as a joint and your adjusted gross income is below $170,000, then your premium would be the base premium of $148.50. If your adjusted gross income is higher, depending how much higher, Medicare has a scale and they calculate, and then you would receive a letter from Social Security and saying, based on your income for your Part B, you have to pay X amount of money. If you collect Social Security, Medicare takes this premium directly out of your Social Security distribution to you. You don't have an option. They just take it straight off your Social Security. If you haven't started collecting your Social Security, then they would bill you and you would have a voucher and you pay for that monthly. The deductible for your Part B in 2021 is $203. Remember, these are the deductible may be covered by the private insurance that you get. But when you get private insurance, that private insurance does not cover your Part B premium. That's completely separate. And, you know, no matter what kind of insurance you have to pay for your Part B. Now, this is very important. If you turn 65 and you do not have any other creditable insurance through your employer or your spouse's employer, and if you decide not to go and get Medicare Part B because you may think, well, I'm really healthy, I never even go to see a doctor, I really don't need Part B. When I get sick, then I'll go get Part B. Well, it doesn't work that way. If you turn 65 and you do not have creditable insurance, for every year that you do not have a creditable insurance, you have to pay 10% penalty for every 12 months. Which means if you turn 65 and you wait until you're 68, and then you're going to go and apply, it would be 3 years times 10% times 3 is 30% would be added to whatever your premium is, whether you pay the base premium or whether you pay the increased amount. So it is extremely important that when you turn 65, if you don't have creditable insurance, go and get your Part B. Don't let that fall, and then when you need it, you realize you have to pay a lot more for it. Okay, so we move on. We're going to go to Part C now. Now, Part C is also known as Advantage. So the advantage, as I mentioned, Medicare has made contract with private insurance companies. So the private insurance company basically handles your Medicare needs. In order to get Part C, you have to be, you have to have applied and you have to have received Part A and Part B, and you have to be current in making your premium for Part B. Generally, Part C include prescription drug. There are a few plans that may not include prescription drug, but generally, majority of them include prescription drug. And many of them includes additional benefit, as I mentioned, like gym membership or allowance for over-the-counter prescription drug, transportation, or many other benefits, depending on the plan. And the premium you pay for Part C and the deductible you pay for Part C is basically depends on the plan you're applying for and the county in which you live. So Part C is really tied to the county when you live. In order to be eligible for Part C, you have to be enrolled in original Medicare and have Part A and B, and you have to live in the service area. Service area generally ties to the county where you live. Okay, now supplement. Remember, supplement was the option 1. So supplement is provided by private insurance companies, and generally it fills the gap that Medicare Part A and B does not cover. You have 6 months from the time when you get your Part B to sign up for a supplement plan without any question or regardless of any of the pre-existing condition. So you have 6 months window to go and get your supplement plan. It allows you to go to any doctors, any hospitals, anywhere in the whole US, as long as they accept Medicare. The premium increases by your age, and it does not cover prescription drug. Okay, now I'm going to pause again and see if there is any questions that anybody has that you want to ask.
Yes, we have several questions.
Okay.
We have very good listeners with very good questions. The first one is, can you change plans from year to year?
Yes. With the supplement plan, you can change it at any time. However, once you get in, the first time you get in, whether you're turning 65 or whether you just retired, you want to get into a supplement plan, you have a guarantee you can get in without any medical question asked. But once you get in, if you want to change it, then you may be subject to medical questions. Now in California, they have a thing called birthday rule. So if you change it the month of your birthday, you skip answering the medical questions. But if you change it any other time, then you have to answer the medical questions. And if your answer is yes, you're subject to underwriter and they may deny your application. With the Advantage plan, I'm going to cover it in the future slides when I go over eligibility period. Once a year, they allow you to switch. You go from another advantage to one advantage to another advantage, or one company to another company. Or you may want to switch from an advantage, go to a supplement. As long as you can answer medical questions and everything is okay, you can switch. Now, remember, there's no requirement for the advantage. So if you have supplement and you decide you want to switch from supplement to an advantage, at annual enrollment, they don't ask you any medical question, you can switch. So did that answer your questions?
Well, we'll go on to the next question, and if that person still needed answers, they'll
Okay.
write us another question. So, what are actual cost comparisons? And this was asked early on when we went to the second question. So I think they're probably talking about some of the first material you went over.
Okay, the actual cost really varies. So in this webinar, we really covered the basic of Medicare. Because if I want to get into the actual cost, I mean, we should have a 3-hour session. Just to give you a range, with the Advantage plan, depending which county you live, there are plans that has a 0 premium. And then it could go up all the way to possibly $100 a month, depending which plan you choose. With the supplement, it starts about 120, but it varies from company to company and from county to county. So it really is, you know, I have to talk to you directly to say, well, where do you live? And, you know, what's your zip code? And then I can find out exactly what area you are and which premium applies to you. So again, the range really varies. And when you look at the plan, don't just look at the premium to say, oh, this is $10 cheaper, so I want to get this plan. Look at it holistically, look at it and say, okay, what are the benefits? What do I get? What's my copay if I go to a hospital? What's my copay if I go and see my doctors? You know, what is, how good is their network? How many doctors they provide to me? Which are the hospitals I have to go to? So look at the whole thing and then make a decision. Just the fact that a plan says 0 premium may not necessarily be the best plan for you.
Okay. So our next question is, for inpatient stay, what happens after 100 days?
Well, generally, after 100 days, remember you have 60 lifetime days. So after 90 days, if you have to be in the hospital, you get another 60 days. Now, this is only what Medicare offers. If you get additional insurance, whether it is option 1 or option 2, they add days to your coverage. This is only if you have Medicare Part A. So by getting a Medicare supplement or Medicare Advantage, they add to the number of days you can stay in the hospital. But generally, unless your situation is really critical and you are in an ER, in a hospital after 90 days, if you have to stay there, they transfer you to a skilled nursing. Because if your condition is such that is, you just, is not critical, is not ER, you don't, you want a skilled nurse to come and take your temperature and kind of watch you. So then in that case, you go to skilled nursing, which you would get 20 days. But then if you sign up, let's say for an Advantage plan, you can get up to 100 days at the skilled nursing. So, and then after skilled nursing for 100 days, if your condition is improved, but occasionally you need some skilled nurse to come and monitor you, so they may send you to go home. They call it home health care. And in that sense, you stay at your own home, but a skilled nurse comes and monitors you occasionally.
Okay. So the next question is, deductible of $203 for Part B, is that annually?
Okay, very good questions. Let me give you a little bit of definition. When I say deductible, the deductible means once a year. And generally, you have to meet the deductible before the insurance starts covering you. So in this case, your Part B has a $203 deductible. So that means you have to pay that out of pocket before insurance covers you. However, when you get the additional insurance for option 1 and option 2, they may pay for this $203. So you don't have to pay for it, depending on what plan you sign up.
All right.
Okay, let me mention one more thing. So that's for deductible. When I say premium, premium is a monthly fee. Premium is what you pay every month for your Medicare Part B, or for your Advantage, or your supplement plan. So premium is monthly, deductible is annual, copay is per usage. So if you have a $10 copay every time you see your primary doctor, you only pay the $10 if you go and see the doctor. If you don't see the doctor, you don't pay. Okay.
Okay. The next question is, what is considered late enrollment?
Late enrollment is actually, I am going to cover that in the future slides. Basically, late enrollment is when you turn 65 and you don't have creditable insurance, then Medicare gives you a short window. Within that window, you have to sign up for Medicare, and if you don't sign up for Part B and Part D, then you pay a penalty. But as far as the window, I'm going to cover it later.
Okay. If you're working until 70 and you had insurance until 71, would you be penalized with the 10% increase?
If the insurance your employer is providing you is considered creditable, which means as good or better than what Medicare offers, then you will not get penalized. But if you, let's say, work for a small company and they only give you partial insurance, and Medicare does not accept that as creditable, you may be subject to penalties. So the best is for you, if you're turning 65, talk to your HR and find out the insurance they provide you, is it creditable as far as Medicare is concerned or not.
All right. What is the AGI limit for no Part B premium increase? Is it the same as if we would go with option 2?
I'm sorry, say that again.
Okay. What is the AGI limit for no Part B premium increase?
Okay, AGI, I'm assuming is adjusted gross income. So
I guess so.
The minimum premium for an individual annual premium is $85,000 a year, and for a joint couple is $170,000 a year. So if you make less than those thresholds, you can pay the base premium, which is $148.50 in 2021. But if you made more, adjusted gross income was higher than those two thresholds, $85,000 and $170,000, then Social Security would calculate and let you know how much more you have to pay.
Okay. How much does that supplemental plan premium increase each year?
Anywhere from 3 to 6%. Generally around 3%.
Do the Advantage plans increase in price over time?
It doesn't increase year per year by your age. So whether you're 65 or 95, you pay the same premium. However, from year to year, there may be a few dollar adjustments. Sometimes it goes down. Sometimes from $50, they say, okay, pay $48 for the same plan. Or they may say, no, pay $55. So when they look at each company, when they look at their how many members they have and what is the cost for them to keep the plan, they may make adjustments, and they let you know in advance that next year your premium is going to change. And then you can decide whether you want to stay with this plan, or during annual enrollment, you may want to change.
Okay. Part B premiums are based on taxes filed. My husband and I filed jointly. He is retired. I still work. If my income goes up, does it reflect only in my premium or his as well?
No, unfortunately, it impacts his. So if you are working, assumably he did not get his Part B because he's covered under your insurance. So if he didn't apply for Part B, therefore he doesn't need to worry about what his income is and what is his premium is going to be for Part B. But if for some reason he did go and apply for Part B and he's paying for Part B, if you file your taxes as a joint, unfortunately, the total income of both of you is compared to the $170,000 threshold, and then you have to pay, he has to pay a premium based on that.
Okay, all these are so good. Many questions that didn't come to my mind, but so we still have some more. If a person is self-employed and buying insurance from the market, does it suffice enough to delay enrolling in Part B? So
if the insurance, generally, if you are self-employed, you have to see what kind of insurance you have. If you're self-employed, most everybody, once they turn 65, they go to Medicare, because Medicare is a lot cheaper than when you buy insurance as a 64-year-old person. Because as a 64-year-old person, even if you have your own business, you're paying a lot of money, even if it's group insurance for your insurance. So generally, it makes sense to go to Medicare when you turn 65. However, it basically goes case by case. So if you're turning 65 and you have your own self-employed insurance, talk to a broker and see what your situation is, and talk to your to Medicare to see if it impacts you. And in that case, you have to see if your insurance is accepted as a creditable insurance or not.
Okay, the next question is, if I move, do I have to do everything over?
Okay, if you have a supplement plan and you have to move anywhere in the US, all you need to do is you call your member services and you say my address has changed, and then everything else is the same, except that you probably need to, in the new area, you need to find new doctors. But your coverage, your insurance does not change. You just call them and said, okay, I moved. I went from, let's say, Palo Alto, I moved to Sacramento, or I moved to Nevada. Whatever you move, the whole United States, your insurance is covered. But if you have an Advantage plan, the Advantage plan is really tied to the county where you live. So as long as you move out of your county, you have to, when you know you have to move, check with the new county and find a broker that is certified to provide you plans in the new county, and then see what's available there, what is the premium benefits, and then you have to sign up to a new plan.
Okay. The next question is there someone who can sift through all the Advantage plans to help me decide which one is best for me?
Yeah, brokers, can help you with that. You can always call me after, tomorrow or the next day. And basically, I would look at your zip code, and then I would tell you what kind of Advantage plan is available in your county, and then what each
I think we've lost the audio for you.
Okay,
Okay, we can hear you.
any more question?
Yes, there is. For age 65 male, what's the approximate cost for Kaiser Advantage plan?
I don't know. It varies. I do not represent Kaiser, so I can't quote you Kaisers. And basically, in this webinar, we don't quote prices.
Right. The next one's a pretty complicated one. With a PPO plan, I go to 2 doctors, and I think that this is probably a longer question. And
yeah, let's cover that
yeah.
at the end.
Yeah. So would you okay, so how about out of state coverage, option 2, and out of the country coverage, like you go on vacation?
Okay, so both option 1 and option 2 cover you for emergency if you are out of your area or even out of country. If it's an emergency, they cover you. But if it's not an emergency, then option 1 covers you anywhere in the US as long as you go to a doctor that accepts Medicare. But option 2 does not cover you if you have an HMO. And then if you have a PPO, it may cover you, but you have to pay more, the cost, whatever the difference is, the cost of your doctors. So it generally is not advised to go to, see other doctors when you have an Advantage plan, unless you know exactly what you're doing. If it's an emergency, they cover you, but non-emergency, they don't.
Okay. The next question is asking about your contact details. That will be on the last slide.
That's on the last slide.
And we will be sending the slides to all the people who registered for this. So if you have to go early, and it's also going to be on the YouTube channel. Another one is, do brokers charge a fee?
Okay, good questions. No, talking to me or to any other broker is not going to cost you anything. Whether we meet in person, which we rarely do now that because of Corona, but talking over the phone or over Zoom is not going to cost you anything. Now, should you decide to sign up for a plan through me, then the company that you're signing up with would compensate me, but you do not have to compensate me. And you don't really get a discount whether you go through me or whether you do it yourself directly. So it's always good to find a broker that you trust and go through them and let them answer all your questions, so you make sure that you're signing up for the right plan.
Good news, we're ready to go on to the next part.
Okay, so then let me move on. Okay, so now we're going to go to prescription drug. The prescription drug, again, is provided by Medicare-approved private insurance companies, and they help you to lower the cost of your drugs, basically because when you sign up with a plan, until the end of the year, your drug costs will not go up. You would stay on the same plan. And your premium would depends. It goes from, depending what plan you sign up with, your premium changes. And if your prescription drug is part of your Advantage, then you don't pay for it. There is a deductible. There may be a deductible, depending what plan you sign up. And the deductible range goes from $0 to $445 in 2021. Now, just like Part B, Part D prescription drug also has a late enrollment penalty. And the enrollment penalty is after your initial enrollment period, if for 63 days you do not have a prescription drug coverage and you do not have any creditable insurance that would cover your prescription drug, then basically you're subject to a penalty. the penalty in the case of drugs is 1% per month. So again, some people may think, well, I'm healthy, I don't even take any drugs. Why do I need prescription drug coverage? When I get sick, I'll go and get one. Well, it doesn't work that way, because when you need it, they count the number of the months that you were eligible to get the prescription drug and you did not have a creditable coverage, and they add that 1% penalty to your premium. And the penalty is based on the national average premium, which is around $30 per month. So be very careful, go and find, even if you don't take any drugs, either sign up for an Advantage plan that gives you the prescription drug for free, or if you have to sign up to a standalone prescription drug, find a cheap plan so that you don't pay as much premium, but you don't pay the penalty. Okay, so now what I'm going to cover here, still we're covering prescription drug. This applies to whether you get your prescription drug as a standalone prescription drug, or whether you get your prescription drug coverage as part of your Advantage plan. So drugs are classified into 5, or some companies have 6, what they call it, tiers. Tier 1 and 2 is for generic drugs. Tier 3 and 4 are for brand drugs. And tier 5 is specialty drugs, very expensive, like chemotherapy and expensive drugs. So obviously, the lower the tier, the cheaper the drug. So if you get a generic drug, it's going to be cheaper than if you get a brand drugs. So when you get into the prescription drug plan, first they look and see if you have a deductible with your plan. If your plan has a deductible, you have to meet your deductible first. After you meet your deductible, or if your plan does not have any deductible, then you start with the first phase, which is called initial coverage phase. During initial coverage phase, you pay a copay or a co-insurance for every drug that you take. And you stay in the initial coverage phase until your total cost of drugs, which means what you pay and what the insurance company pays, reaches $4,130. This is for 2021 numbers. So as long as your drugs, everyone, January, February, March, as you buy your drugs, as long as you are below 4,130, you stay in initial coverage phase. If at any time during the year you reach 4,130, then you move to the next phase, which is called coverage gap. Some people refer to this phase as donut hole. So if you fall into the coverage gap, then you pay 25% for generic drugs and 25% for brand drugs. And pharmaceutical company pays the difference. Now, there are some plans that if you have generic drugs, they may cover you during coverage gap. So when you sign up for a plan, you have to read the whole thing and see what kind of coverage you get. And you stay in the coverage gap until your total out of pocket reaches $6,550. Now, this total out of pocket is what you pay. It's not what the insurance company pays. So everything you pay, your deductible, your copay, your co-insurance, and actually even when what pharmaceutical company pays rolls into this $6,550. Once you reach $6,550, then you move to the next phase, which is called catastrophic. Now, during this phase, you pay $370 per month for a month of generic drug and $9.20 for a month of brand drug, or 5%, whichever is higher. So basically, the insurance company covers you in the initial coverage, and it covers you in the catastrophic. If you are in the gap, pharmaceutical gives you a break, but the cost of your drug goes up. Now, the message here is try to get your drugs as generic, because if your drugs are generic, chances are you will not have a deductible. A lot of plans, if you drugs are, they don't have a deductible for generic drugs. And also, if your drugs are generic, you're not going to reach the $4,130 threshold. So you stay in initial coverage phase and you not move to the coverage gap. So it's very important to keep that in mind. Okay, so now here we're going to cover some definitions. Pharmacy network, each plan has its own preferred pharmacy. They say if you go to their preferred pharmacy, you get better pricing. If you go to standard pharmacy, which is any pharmacy that's not their preferred, then you may have to pay more. But generally, you need to do your own homework and see which pharmacy is best for your drugs. The drug formulary is a list of your drugs. So if you go online for any plan, or if you sign up for a plan, they send you a list of their formulary. You can, they're alphabetical, and after each drug name, you can see a letter T with a number. The T stands for tier, and the number tells you what tier it is, so you can see how much you have to pay for the drug. Tiered formulary, again, as I mentioned, most companies have 5 tiers. Tier 1 and 2 are generic. Tier 3 and 4 are brand, and Tier 5 is a specialty. Some companies recently have come up with a Tier 6. Tier 6 are for drugs that are very commonly used, maybe for cholesterol or some diabetic drugs. They group them and classify them into a Tier 6. Step therapy is if you have to take a brand drugs, the plan would want you to try that drug in generic first before you jump into a brand drug. And the quantity limit is generally with each drug, they'd say 1 a day, 2 a day. If for some reason you need to take a higher dosage, your primary doctor has to send a request to the plan and say, for you, you need to take 3 pills every day, and then the plan would approve it and you take 3. Prior authorization, again, if a drug is not on the formulary list, your primary doctor can send a request to the plan, and the plan would review it, and they authorize for you to take the drug. The coverage decision is if the drug is emergency and you really need it, your doctor can request it, and within 72 hours, the plan would review it and approve your drugs. Okay, so I'm going to pause and see if anybody has any question on different phases of drugs or any question on drugs.
We do have one question. Does a prescription RX card count as having prescription coverage? Usually they have excellent prices.
Yeah, if you want to get your drugs from, I don't know prescription, I'm not familiar with prescription RX, but if you go to some pharmacy that is not known, you just have to make sure the pharmacy kind of deals with Medicare, because remember, Medicare accumulates the cost of your drugs, and it would tell you whether you're still in initial phase or whether you, they have to keep that there is a tally. Both the insurance company and Medicare keeps track of your drugs to make sure when you reach 4,130. So if they have no record of what you paying, then you may end up paying everything out of pocket. But I think RX, is that the Amazon insurance? I'm not sure. But if it is Amazon, it's creditable, but I'm not sure what kind of
I'm not
prescription
either.
drug.
But someone else is asking, does Medicare have MDs reviewing prescriptions for authorizations?
Medicare does not cover prescription drug. So the insurance company would review it to authorize the Medicare would overlook everything, including prescription drug, but they don't cover prescription drug. So the insurance company has people that would authorize the doctors or pharmacists that when your primary doctors send the request and say this person has to take this drug, then they review it and they approve it. It's very common to approve a drug unless your drug is so expensive and it's very unusual, then it may take longer.
Okay, so just a follow-up on that one. Do the insurance companies have MDs reviewing prescriptions for authorizations?
I don't know if they have MDs or they have pharmacists. They would review it, and it's really, I mean, they've done this for many years, so they know which drug people would want, and they review it and they approve it. So whether they have, group of MDs that would get all the requests and they would review it, I'm not sure.
So the person who had mentioned the prescription RX card says anyone can get a card, in kind of when we were saying we're not really sure what that was. And then just a comment from someone, we are old, things should be easier. So it's someone's recognizing that this does sound very complicated.
It's very complicated. They really, they made it very complicated, especially when it comes to drugs. So, I mean, it's, the formulary changes all the time. The classification of tiers switches from one to another. That's why every year, even if you have a plan and you're happy with it, you need to check with your broker every year to make sure that there's no change in your plan. And so you kind of have to stay on top of it. It's not, it's not, they didn't make it very easy.
I think we're ready to go on.
Okay, good. Now we're going to talk about eligibility period. There was a question previously that I said I would cover it when we get to this phase. I think it was to do with paying a penalty and when do you pay the penalty. So now when you turn 65, again, you are eligible to get your Medicare card. And when you are just turning 65, you are under the initial enrollment period, IEP. For the initial enrollment period, you have 3 months before the month of your birthday. You have the month of your birthday and 3 months after the month of your birthday. So it's a total of 7 months that you can go and apply for your Medicare and your additional plan option 1 or option 2 before you considered late enrollment. So during this, for example, let's say if your birthday is on July 15, you really have from April 1st until October 31st to go and apply for your Medicare card and get your supplement or advantage plan. If you apply it in April, May, or June, the effective date of your Medicare card and your advantage or supplement card would be July 1st. regardless of what the date of your birthday date is, the plans always start the first of the month. So again, if you apply April, May, June, the effective date for your Medicare or your plan would be July 1st. If you apply for it in July, August, or September, then the effective date would be the first of the following month, which means if you apply in July, your effective date would be September 1st, and so on and so forth. So you really have plenty of time, but you got to remember, you got to go and apply and get your Medicare Card Part A and B first before you qualify to apply for an Advantage or a supplement plan. The next enrollment period is the green section. It's called the annual enrollment period. And annual enrollment period is from October 15th through December 7th, which is basically, this is the period we're in right now. Very soon it's going to be October 15th. So this is for those who are already, they already have Medicare. Once a year, they get the opportunity to change their company and go from one company to another, or go from one plan to another, or go from supplement to an Advantage, or from Advantage to a supplement. So once a year, you have the opportunity to switch. Now, again, remember, to go from a supplement to Advantage is very easy. There's no medical question asked. But if you go from an Advantage to a supplement, there are a few criteria that you may qualify for, not to answer medical questions, but other than that, you have to answer medical questions. So the next enrollment period is open enrollment period. The open enrollment period is this blue section, which is from January 1st through March 31st. This is only for those who have a Medicare Advantage plan. So Medicare is giving you 3 more months in case you want to switch your Medicare Advantage to another Medicare Advantage. And in some cases, you can, if you have Medicare Advantage, you can drop it and go to the original Medicare, which means then you don't have any additional coverage. And finally, the last enrollment period is a special enrollment period. This special enrollment period could be any time during the year. So basically, you have to qualify for certain event in order to qualify for a special enrollment. If you retired, let's say you retired March 15, you already know you're going to retire, you're going to apply for your Part B, you're going to apply for an Advantage or a supplement effective March 1st, so you're covered. If you move from the service area, you go in case of Advantage from one county to another county, you qualify for special enrollment. If you receive assistance like Medigap, you qualify for a special enrollment. If you've been diagnosed with certain disabilities or chronic illnesses, you qualify for special enrollment. Also, if you get extra help with your prescription drug, I'm going to cover that next. So basically, you have to have certain event that allows you to use the special enrollment. And during the special enrollment, again, it could be any day or month of time. You apply for the plan you want. You go and get your A and B first, and then you apply for your Advantage or supplement. And lastly is the extra help with prescription drug. So this is a plan offered by state of California. So some people, if their income is very low, they qualify for Medi-Cal. But some people make a little bit more than Medi-Cal, but they still don't make that much. So these are the thresholds and the limits that if your income is or resources is higher, excuse me, higher than Medi-Cal, but still not that high, you may qualify to get help with your prescription drug. So if you're not sure, go to medicare.gov and look for LI. It's called Low Income Subsidy, LIS. Look for that form and request it and apply for it. And then Medicare would look into it, and they tell you whether you qualify or if you don't qualify. So basically, that's what it is. And then finally, this is my business card. Again, Marcy said she's going to post this on YouTube. You would have a copy of this or take a picture of it. I represent these companies. And again, if you have any questions, don't be shy. Give me a call. There is no cost talking to me or asking me questions or consulting with me. And it's always good to make sure the plan you get in is the right plan for you, because it's not one size fits all. You know, one could be the best plan for, like, for example, a husband may want to get into an Advantage plan, but the wife may be a better plan to go to a supplement plan. So, you know, you really need to look at your situation individually. Okay, that's it. Is there any questions at the end?
Yes, we do. We have a couple questions. The first one is there any California state assistance?
Yes, there's California in it for the LIS. They may have some programs that if your income is higher than the LIS threshold, if you apply, depending on what your situation is, they may have some programs that they can help you. And even if they cannot help you, there's also, you can ask the pharmaceutical company to give you, if you have expensive drugs and your income doesn't qualify for any of these thresholds, I've seen people directly communicating with the pharmaceutical company, requesting them to provide them the drugs at a cheaper price. So there are some resources, but you know, you don't get anything for free unless you are in Medi-Cal.
Okay, someone had another question for clarification. In order to get Part C, I need to enroll in both A and B first. Is that correct?
That's correct.
But only need to pay premium for Part C. Is that correct?
Only you need to pay premium. See, Part B, let me go back. Okay, Part B has a premium. It's $148.50 base premium. So this $148 or a higher amount, depending on your income, you pay to Medicare. You have to pay this to Medicare. You have to have A and B in order to qualify to get either a supplement or an Advantage. So that's to Medicare. Once you come here, then you would have another premium if you get a supplement, or another premium if you get Part C. So this premium is completely separate from the premium you pay for Part B.
Okay. Someone says, I only worked for a brief time period when I was younger. How do I find out how many months I have worked in my lifetime? How many months did I have to work in order to qualify for Medicare?
Okay, you need to have worked at least 10 years or 40 quarters and have paid your Social Security and Medicare taxes in order to be entitled to Part A and qualify for Part B. The way to find out is you need to call Medicare or go to their website, medicare.gov, and give them your Social Security number. They can help you and let you know if you're short some quarters. Now, if you're short a few quarters away from the 40 quarters, then you may be able to get Part A but at a price. You may have to pay some premium for your Part A, because since you didn't work 40 quarters, you don't qualify for free Part A, no cost Part A.
Okay. John, or I wasn't going to use any names, so sorry. Someone is asking, do you know what the Biden administration is working on changes for Medicare for next year, if approved?
No, we wouldn't know until it's announced.
Okay.
We can
Then,
anticipate.
Then the person who asked a more complicated question said that we would try to get back to it at the end. So let me go up towards top, and it's with a PPO plan, I go to 2 doctors and get 2 cataract consultations. If both doctors agree on the diagnosis, will Medicare pay for the 3rd opinion? Medicare says I could get 2 doctors consultations in 2021 and an additional 2 doctors consultations in 2022. Or is it 2 consultations in my life for life? I was advised to get 3 with 3 different eye measurements.
This is Medicare, or this, what kind of, is a PPO plan?
Yeah, she starts out with, it's a PPO plan.
Yeah, I would check. I would definitely check, because there is a limit how many second opinion or third opinion you need to get. So I would check with the plan first to see what the plan covers. If the plan only covers 2 consultations, then if you go to the 3rd one, most likely you have to pay out of your pocket. You really need to look at your plan, to see what the coverage you get with your plan.
Okay, but then so her next statement was, will Medicare pay for a 3rd opinion?
No, Medicare will not. Medicare will not pay for a 3rd opinion, because generally the plan would follow what Medicare follows. So if the plan says you're not going to get a 3rd opinion, Medicare is not going to pay for the 3rd opinion.
Okay, we have a new question. I have heard of secondary insurance, like through a former employer related to Medicare. How does that work?
I'm assuming she or he is saying that she is retired and she's getting Medicare, but it's through her ex-employer. So
Yeah.
The way that works is through her ex-employer, she got her Part A and B, and then the ex-employer, as a group retiree, provided some sort of a Advantage, PPO, or HMO plan that she's paying for it. In that case, what my recommendation is, find out how much that plan is costing you, because usually group retiree plans may be a little bit more than what if you go directly to Medicare and get your own insurance, A and B, and then get your own Advantage plan or supplement plan. So before you cancel anything, it's always good to talk to first of all, find out from your ex-employer how much this plan is costing you, then compare it to what it would cost you if you go directly to Medicare, and then see what your choices are and what's the best decision.
Okay. We have a couple of people. This is just one representation of some of the comments that have been left. Is they want to thank the library system and presenter for excellent introduction and presentation. Even though it does lead to more questions, I will be turning 65 next month and definitely is going to get in touch with you. So there were others that were also thanking and saying that this was such a wonderful program too. But that was just one representation.
Okay, thank you all. Again, don't be shy. Give me a call. just, consult with me, ask me questions. If I don't know the answer, I can always find the answer and get back to you. And, I just want to make sure that when you make a decision, it's the right decision that best fits your needs.
We do have two more questions that relate to working less than 10 years. One is, so what do I do if healthcare coverage, if I didn't work for 10 years?
Well, you need to contact Medicare and see how many quarters you have worked and what kind of the premium you have to pay. And then you work with them until you get your Medicare cards. Once you get your Medicare card through from Medicare, then you can get additional insurance.
And
I don't work for Medicare. No broker works for Medicare. So we basically cannot give advice that Medicare would give you. We're not allowed.
Another person says, I am a stay-at-home mom and don't have 10 years of work. Would I qualify under my spouse's work time?
Yes. The spouses qualify under a spouse's work time. So it's covered, whether a wife is working, the husband is covered, or the husband is working, the wife is covered.